It has been over a year since the COVID-19 virus changed the world as we know it, and it seems as if there has been a pause on the world, and people are hurting from it. Many people are grieving as more lives are lost every day from the virus, but the fact have arisen that a specific population of America has been hit harder than the rest. We're lucky enough to get in touch with an undocumented person who is willing to share their story. It seems that a majority of our essential workers are people of color, even though they already have poor health care even before the virus. It does not help when these communities also have high rates of pre-existing chronic health conditions that can cause the effect of a virus to be more severe than on others. There is also a group of people whom did not even get government's stimulus check because of their undocumented status, which makes an already difficult situation even harder.
My dad was an essential worker. He works at a recycling thing, and he got hours in the morning. And my mom, she's a cashier. She is an essential worker per se, because people still go to restaurants, but she lost a lot of hours because many people can't afford to go eat because they don't have money. And I think this was really helpful through hard times that my dad was an essential worker, because I had aunts and I had tios, uncles, and some of them were not working, so it was just none of them were working, and they faced more financial hardship than we did. But I think something that helped is that I have a big family per se, so we were able to support each other. When they needed money, my parents were able to loan them. So even though we don't have as much, but we loaned them enough to go by the pandemic. And I think that was just so helpful, because without that it would have been chaos, or where else would we get help? And yeah, I think that was really helpful.
During this pandemic, many individuals have the privilege to work from home and can keep distance from others, keeping them safer from the virus. Yet, there are also a lot of people who cannot afford this privilege and are forced to continue to work. That puts them at constant risk of contracting the COVID-19. Much of this population are minorities, and this can be linked to the higher number of COVID cases within the minority community. According to the Center of Diseases, among cases with known race and ethnicity, 33% of persons were Hispanic, 22% were Black, and 1.3% were American Indians and Alaska Natives. These findings suggest that persons in these groups, who are accounted for 18%, 13%, and 0.7% of the US population, respectively, are disproportionately affected by the COVID-19 pandemic. The analysis of COVID-19 associated hospitalization surveillance network data have found higher proportions of Black and Hispanic persons among hospitalized COVID-19 patients than were in overpopulation. When you think about how while Black Americans represent just over 13% of the population, according to the census, Black workers encompasses 15% of all essential workers in the pandemic, according to the EPI data. Meanwhile, Hispanic or Latinos represents just over 18% of the population, but make up 21% of essential workforce. When you notice how both Latinx and the Black communities represent a higher percentage of essential workers than their percentage in the population of the United States, really places in perspective why they are so at risk. If you take a look at the New York City, of which 75% of all essential workers are people of color, there is a drastic difference. When you take into notice the difference, it is incredible not to see why there is such an impact on colored communities. Many of these people do not have the choice to stay home because they just cannot afford it financially. Many colored neighborhoods are living in poverty and live paycheck to paycheck. The risk of infection may be greater for workers in essential industries who continue to work outside the home despite outbreaks in their communities, including some people who may need to continue working in these jobs because of their economic circumstances. The CDC states on their website in a post breaking down COVID-19 in racial and ethnic minority groups. which explains why many of the colored families have to continue working in order to keep surging, even if that means putting themselves and families at risk. For them, not working is even more devastating than the risk of getting coronavirus, and it is a tough decision many have to make.
2 is about healthcare. It is evident that this population of people are at higher risk of contracting COVID-19, but they also have a difficult time of getting proper healthcare. This problem is not specific to just this current pandemic, since minorities getting proper healthcare has always been a problem minorities have faced. If we pay attention, people from some racial and ethnic minority groups are more likely to be uninsured than non-Hispanic whites. Healthcare access can also be limited for these groups by many other factors, such as lack of transportation, childcare, or the ability to take time off work. Communication and language barriers, cultural differences between patients and providers, and historical and current discriminations in healthcare systems. These are just examples as to why colored minorities have bad or no health care. If you are living paycheck to paycheck, taking time off with no pay is not possible. If these people are at constant risk of contracting coronavirus but cannot afford health care, they will probably not get tested if they have symptoms. This can cause for their own health to become worse and can also increase the spread of the virus to other people.
According to CDC's, among the 287,320 cases with data on individual underlying health condition, those most frequently reported were 32% of cardiovascular diseases, 30% of diabetes, and 18% of chronic lung diseases.
According to the health insurance coverage in the United States 2019 published by the U.S. Census, in 2019, coverage differed across race and Hispanic origin groups. The uninsured rates for whites and Asians were 5.2% and 6.2%. The percentage of blacks and Hispanics with no health insurance coverage for the entire calendar year was higher than for non-Hispanics, at 9.6% and 16.7%. Respectively, Hispanics had the highest uninsured rates among all race and ethnic groups. These numbers should not be here, as everyone deserves the right to have health insurance, but it seems to be a privilege in this country instead of a right.
Health-wise, my parents don't really have any insurance. I have medical insurance now because of the school, but overall, we don't have medical insurance, and if we do, it's the really cheap one, because we can't really be affording that when we have to prioritize food, our paying for rent, all those other things come before, and then when it's time for this other expenses, it's just they didn't make the cut. So if my parents were to get COVID, there wouldn't be much help. There wouldn't be much we could do. And right now, I think for them it's kind of hard, just not knowing where to get help. I don't think we get tested regularly, just as other people do, or they don't get tested every week or that, because they don't have that help. And I think if they were to get sick, they would either have to just pull through. My mom's work doesn't really care. If they're sick, they're just wear 2 face masks, be really careful. And I'm not proud to say this, but it's they'll probably have to go to work, because how else are they gonna get money? The government's not helping. People are still going out, so it's just something they have to do. It's a necessity. People are going out for fun. They have to go out because they have a job and they have a family to support. I have 2 other brothers and 1 sister, so one of the biggest challenges my family and I faced was financially. When the pandemic started, my mom lost a lot of hours from her job. My dad had 2 jobs. He essential worker, so he was still going to work, but even so, the hours were like limited, and he had like sick days, so he put that like to use them to get more money, so it was like a loophole we had to find. And another challenge was not knowing what was going to happen. I feel like as an undocumented person abroad, that's always like that's always a challenge. Not knowing if I'm gonna be deported, not knowing like I've seen videos of ICE going to these jobs. Like that's always a challenge to try to get that out of my mind.
There are people who didn't receive COVID aid. It seems like lack of empathy is still dominant even in COVID times. According to 12 News and the article, Arizona senators don't want undocumented immigrants to get federal stimulus aid. Adriana Loya points out how Arizona Senator Kristen Sinema and Mark Kelly refused to get undocumented immigrants a stimulus check to help them pay their bills, among other needs that they got to cover because of the pandemic. In the article, Loya mentioned, Latino are among the groups with the highest positivity rates, as they tend to be essential workers. Keeping stores stocked, hospitals, and trash pick up from your home. The author relies on the Latino community to express how they help with essential jobs that the country needs to keep running. However, those jobs mean a higher rate of exposure to the virus. In Arkansas and Indiana, the Cotton Bill was passed. The bill denies stimulus check for undocumented immigrants in the pandemic. The author Casey Frizzell mentions how Senator Tom Cotton and Todd Young agree with this amendment because it will break the law to help illegal immigrants who don't pay taxes. For them, the money should be used to help American people, resources, and the economy of the country. Senator Tom Cotton against Senator Todd Young of Indiana introduced an amendment to the fiscal year 2021 budget that would prohibit illegal immigrants from receiving stimulus aid.
I think a solution would be providing undocumented workers with stimulus checks because we do the same thing for the economy. We work and we are essential workers. Like my parents were essential workers, but the government did not care. I think it's only when it's convenient for them. When like they need taxes, so it's like you live here, you have to file taxes. But it's like we live here, we need the help and support because the pandemic is not like, oh, you're undocumented, we're not gonna like, get corona. It just doesn't work like that. And I just think their logic just wasn't right. So in order to help people in my situation, it's like you have to provide help. You have to make sure they are getting the same amount of help as like any other person because as undocumented, it could be a little harder finding a job. I personally would love to help my parents and work, but I can't because I'm undocumented and like I'm scared to get like a fake social security or something to work because what if one day I try to actually get residency and that could affect my future. So I really have to think about what I do because my actions will reflect in the future.